Hey everybody, Dan here with Pain Free You. Today's video I want to talk about medical labels. And you know, I'm a TMS guy. I'm a mind-body guy. I talk about, using the brain to, teach the brain to end your pain, right? That kind of stuff. Not a medical doctor, not a physical therapist, not a chiropractor, any of that stuff. And I will get people on coaching calls or in emails, and they'll say, Dan, I really want to know if this TMS approach will help sciatic pain from a pinched sciatic nerve. And it confuses me a little bit because it causes me to question how well they understand what TMS is. And this is no offense to anybody, because a lot of the people are coming into these videos brand new, just learning about TMS and opening their mind to it. And they are consistently using the language and the medical labels and the diagnoses that their doctors gave them. And so people will get on the phone with me sometimes and start rattling off all of these medical terms and diagnoses and body parts, and I'm sitting there going, I don't know what all that means. But the interesting part is I don't need to, because getting lost in the physical anatomical body is not what TMS is all about. TMS is all about pain created in the brain to distract us from something, or it's a reaction to stress and tension. Some people think it's a message. Not too sure. I just mentioned that yesterday. I don't think it is. Maybe it is. Doesn't matter. Solution's all still the same, regardless of what you believe. So, medical labels. What do they teach you? What do they teach you? Well, all you're doing is repeating what you've been told by doctors who don't have answers for you. Either they say, here's your problem, medical label, medical label, medical label, but I don't have a cure for you, get used to it. Or they're saying, I don't know, everything looks reasonably normal, doesn't explain all of the symptoms or pains you're feeling, in which case medical labels don't do anything. Things like fibromyalgia, neuralgia in general, there's very little proof medically that there is anything wrong with the nerves. And they're coming up with these terms based on the presence of pain that feels more like nerve pain than muscle pain, for example. But by using these medical labels, you're kind of setting yourself up for failure. And the primary reason for that is because your brain's always listening. And if you're describing your pain down your left leg as sciatica from a pinched nerve, your brain's always going to be saying, every time you go to walk or sit down or whatever position or movement causes more pain, the brain's going to go, hey, stop that. That's dangerous. Cut it out. You got a pinched nerve, remember? And so it's really important to, once you have decided and determined and gone through the assessments and determined that it's TMS, call it TMS leg pain. Call it TMS face pain or pelvic pain. Call it mind-body pain, call it neuroplastic pain. Using the doctor's terms is only going to serve to keep your brain in high alert and protecting you from these symptoms that appear to, based on the language and the medical labels, appear to have a physical cause. And so that doesn't help. In the same vein, if you are using tools and gadgets, massage, trigger point massage mats, rolling around in a ball, taking hot baths, doing certain stretches, what's the message you're giving to your brain? This is my body that needs to be handled and treated. And so those are conflicting and confusing messages. So for you to walk around saying, I've got TMS, and it's with this, pinched sciatic nerve. Well, which is it? Is it TMS or is it a pinched sciatic nerve? And I'm going to really encourage you strongly to make the determination through the assessments that I have TMS, too much stress, right? And then drop the labels, because the labels really will keep you stuck. The labels are just as sticky as continuing to go to a chiropractor or a physical therapist or whomever for physical treatments, right? If you think you're going to heal your TMS while still going and getting injections for pain, the brain's not going to give up. The brain's just going to default to safety, keeping you safe from movement, from whatever, by continuing the pain. So medical labels, they're not so good. And plus, if you start to search medical labels on Google, Wikipedia, WebMD, you're going to get a whole bunch of scary stuff. So it doesn't help. Rule out the life-threatening. Cancers, strokes, heart attacks. Rule out something that needs medical attention, like a fracture. I fell out of a tree, I broke my arm. Absolutely requires medical attention. But then rule in TMS. And once you've done that, drop the damn medical labels. The doctor's diagnosis, what they told you before you figured out it was TMS, doesn't matter. It's not relevant. They don't know about TMS. They don't know about the mind-body connection. They don't know about the power of the brain to create symptoms and perpetuate them once they've learned to keep these neural pathways connected and firing. So please, please, please drop the medical labels. I know I've touched on this in previous videos, but yet I still hear it all the time in comments, in phone calls, in emails. Everybody keeps on using these medical descriptions for what's going on. And it's just confusing the brain. It's just convincing the brain you got a problem with your body. So please stop using them. If you guys have questions on this, comment below. If you disagree with this, let me know. But I think when you understand what TMS is, hopefully you'll understand that continuing to use medical labels will only serve to convince your brain that there's a structural physical problem or a disease process or whatever you've got going on or think you've got going on, and pull you away from the TMS way of thinking. So just remind yourself, I've got TMS neck pain, back pain, knee pain, TMS shoulder pain, wherever it may be. It's TMS, it's mind body, it's neuroplastic pain, but it's not these medical labels. So what do you guys think? Is this helpful? Leave me a comment, share the videos, and by the way, people were asking about my eye. It's starting to get a little bit better. It's not quite as puffy, not quite as obvious. The coloration is not as red. It was just a sty and a little bit of treatment with the ointment and a little massage, some heat, and yeah, it should resolve itself. Might take a couple of weeks, but that's okay. Doesn't hurt, which is good news. So thank you. Appreciate your watching. Appreciate all your comments, and we'll see you guys and gals tomorrow. Love you.